this basic training for data collection with the registry. I'm going to go through the basic from logging in to creating users and how you input your first record. And for those who have been using the registry before, how you update and make changes to some of the records you have. First thing is you need to have a username and password to log into the registry, and you check the list of the clinic to make sure your clinic is selected when you are logging in. I'm going to log into the testing bit because we use that for the training, and a lot of users, I always give them account on it to practice also. Once you log in, the first thing I want everybody to do, especially for new people, is to go to the clinic information. You select the clinic information, go and look at the address, contact information, and stuff like that, phone number, everything about your clinic, all the way to the clinic logo also. If you don't have any clinic logo uploaded, try to upload it here. You can come back anytime to, upload the clinic logo, but it's advisable to check the contact information, the clinic information, make sure the address is still where it is, and where it says fax number, because we don't use fax number here, what you can put is not available. You can put N/A in the fax number, but make sure there's always an email, phone number. The medical practice director have the information filled out also, so that during the finalization, you are not going to be getting those soft edits that you need to complete. And it will be so hard sometimes for people because they're already rushing to do this. So let's take note of that. Then after that, you go to the users list. You select the users list, look through the list for your own clinic. If you have names there that has left, that are no longer your clinic, remove them, create account for those that are there. To create a new account for one of your users, you click on create new, you put the last name, the first name, and the email. The purpose of the email is just in case if the person need to send a request to the support, is the email that will get the response back. And then you create a password. The username can be a combination of the first name or the last name, or you can choose whatever you want for your own clinic. But what I do is I always use the first initial with the last name to create the username. And the password has to be alphanumeric and minimum of 8 digits. So try as much as possible to put something. And when you create that user, give the user some administrative right like this. If you don't want the user to unlock cycle, then you can remove this. But in the beginning, give them all the administrator rights. That way, the person will be able to function and do what they need to do. And then once you create the user, you come to the bottom of the page, you click on save, then it will save the user you created. I'm not going to create any user right now. I'm just showing you what you need to do. See how it says I cannot. So what I need to do is go to the bottom and say cancel, because I'm not creating any user anymore. Now, that's about the user. Now, to create patient information, you can start by starting with the patient, or you can start by starting a cycle. Let's assume you decided to add the patient information. Let's say the person come to your clinic for the first time. You can open the registry, input it without even doing the cycle yet. Yes, you can create a patient information. You click on the patient tab, it comes here, you click create patient. This will bring up another form, the last name, first name. Don't bother about this at all. This outside donor and other stuff, don't bother about that when you are creating patients, because the donors that you use in your clinic, you probably have another folder for them. But if you want to input it here, then that means you are only inputting, creating for the donors. So that's not for cycle. Yes, you can check that and create the information and it ends there. But if you are doing for the patient, don't click on the oocyte donor. You input the last name of the partner for that patient. The national ID is not necessary. The clinic ID, this is your own clinic ID for the file that you created for this patient. So don't forget that. And if you have a patient that is not a resident in Nigeria, the option is there also. You can say no, and then you select the country where the patient is from and which city. And if the patient refuses to let you know, then you can select refuse to tell you which residence they have. But they will have an address where they live in while they're in Nigeria. So you can input that here also as well. And if the person is of Nigeria, you put the city. Don't worry about the postal code. It's just the city and the state that matters. And once you create that, you click saved. And the patient information will be saved. As I'm going, if there's any part that anybody doesn't understand, they can stop me and I will repeat it again. Because this one is not like a webinar where we just go straight. So you can send a message or you can raise up and I'll pause, discuss it. So once you have the case patient information created, this filter at the top here is for you to search through your patients after you've created. Let's assume you have like 1,000 patients and stuff like that. And then you need to do a cycle for one of your patients, but you remember the patient's last name, let's say Joe. The filter can be applied to show anybody named Joe. You see, I brought out M. Joe. So if that's not the person you're looking for, then you can search with another name. Let's say Mary. I'm just using this out to show you how the filter is. Because I've seen people start inputting information here and thinking they are creating a user information. No. You see how many Marys I have? Because this is testing me. We've used this for practice for so many times. So from this, I will be able to just pick which of the Mary I'm talking about. So that's what the filter is all about. And once I click on the clear filter, it goes back to my whole list. Now on the cycle, that one I will actually use one of our old records to create that. So when you are creating cycle, you see how it says cycle type, non-donor outside banking, don't select that, just say all cycle. That's the filter. Somebody's talking. Okay. So let's assume I want to search for a cycle with a last name there. See all the patients that I have with the last name Dari. See, that's what that filter does also. So if I click on the clear filter, I go back to the list again. So to create a new cycle, the starting date. So I'm going to create this cycle now, let's say for 2025 January, 2025 January 1st. And this option here, donut outside banking cycle. Now, if you are creating this cycle to bank only, that is when you check that. Because once you start inputting the information and everything, immediately you get to where you collect and store, the cycle ends there. It's still a cycle. So don't look at it like, oh, you made a mistake. No. Then when the patients come back in to properly do the IVF, then you're going to use that banking cycle that you had before as a reference back for the treatment. So once I click on create, it opens up the patient information and the history. So in the history, let's assume I want to choose a patient we've treated before or that we have the information. Then I select choose. If I click on choose, it goes back to my patients list. And I have so many. So this is where the filter comes in. Let's assume now the patient I want to pick is Joe. The last name is Joe. If I click, I'll make sure I select all patients. If I click filter, I have M Joe, but M Joe is not the one I'm looking for. Let's say, okay, let me use the first name, Lola. Okay, so this is one patient. So this is the one I'm looking for. So we want to create another cycle for this patient. I select that patient. It automatically populates the information of that patient into the system. The only thing is the cycle ID for that treatment will not be included yet until you click on the next tab to save it. So the next thing, gravidity. Gravidity is the number of prior pregnancies these patients has had. These include biochemical pregnancies and other stuff. Any of these square boxes that you don't understand what is asking for, when you hover on the box, you get a little cheat sheet on the right here that will help you to know what this is talking about. So let's assume this patient now has gone through one. If I select one, you see the options. Now I have to fit in that one graduality. What type of abortion or what type of issue it is? Is it prior ectopic pregnancy or is it a prior full-term birth or a spontaneous abortion or a therapeutic abortion or prior stillbirth? So these are questions you need to ask the patient during the first time they come around for treatment so that you will be able to know if they said they've gone through, oh yeah, they've had one abortion before, yes, then you'll be able to at least ascertain to that. And once you select which of the abortion is it, let me say, let me pick this prior full-term birth. Then you make sure you select 0 in the orders. This will help you during finalization for that year so you don't get so many soft edits. And once it becomes an habit, you find out like your data is easy to finalize. And this one is asking, as the patient smokes prior to the start of this treatment? If the answer is no, you say no. Now, the months attempted pregnancy since the last clinical pregnancy. So the months now will be the month from that last full-term preterm abortion. So let's say the person had that maybe 4 years ago. So that will be 48 months. So it has to be the time counting, not that they've been looking for pregnancy for 8 years, but they had one about 4 years ago that was an abortion and all the stuff, or it was a preterm birth. So it will be from then. The patient's height. So this wasn't input before. If not, when you select that patient, all this information should have come in. So I would say the height is 180 and the weight 85 kilo. I'm just picking this. And once you click on next tab, if you're missing anything on the previous page, you will get an error that you will see listed on that page for you to go back and correct. So this now, prior fresh heart cycle, because we're using a patient that we've treated before, that's why you see the one automatic in there. See, this indicates the number of fresh heart cycle a patient has initiated prior to the initiation of this cycle. So this will be the second cycle we are doing for this patient now, according to this. So this should include cycles performed at the reporting clinic plus all other clinic. Hearts include intravascularization or transumbilical embryo transfer. You all know this. And if the person has prior frozen cycle before, then it will be listed also here. And then you can go back to the previous cycle where the frozen oocytes were, frozen embryos was done. And immediately you select these. If I say yes, then you're going to see the option for dates in it. But because I'm not, retrieving any frozen, I'm not going to put that for this one so that you guys will be able to understand clearly what it is. Max FSH. If FSH testing for these patients has never been performed, select unknown. Indicate the maximum historical FSH level. So that's what this is. For days 2, 3, or 4, or on any day 10 of the clomiphene challenge test. The upper dosage. So this is not actually looking for whether dosage is whether it's normal. If it's normal, you enter 10. But if the lab reports all level between 2 and 10 as normal, so you enter the upper limit. AMH, what date? The value, enter the female patient's most recent AMH level in milliliter. Reason for coming to do the treatment, all that applies can be checked. You can, ovulation disorder, you can, whatever it is, just select according to what you ask from the patient. And if it's so many, you can use unexplained. So that covers all the diagnosis and all the stuff. Or if it's recurrent pregnancy loss, you can say that. Just pick whatever matters to your patient. Click next. Patient's medication. pick all that matters. Agonist flare, agonist suppression, antagonist suppression, based on your treatment. These are the medications section. Following this is the type of treatment now. I will show you the options we have. Assuming these patients already did the embryo banking first, then when you're coming back to do the treatment, it will be third embryo from donor oocyte that already been banked. So that means you must have a previous cycle for the banking. And when you select that, then you'll be able to reference the date. And if it's fresh, non-donor, you select that also. Just pick whatever pertains to the treatment you are doing. See, this is the option where if it's just a cycle that is banking outside only for preservation, once you select this, the cycle ends after that because you don't need to continue any more treatment. And if you're trying to refreeze again, you select it. Just pick whatever option matters to the treatment you are given. If the patient is using a gestational carrier, you select this, and it's going to ask you the date of the carrier, date of birth. And if the cycle is for research purposes, select it also. Source for the sperm, select what is appropriate. The partner, or it's a donor. Just pick what is right. The status, is it collected fresh or is stored? I'm just going to put fresh. I'll select the partner. Collection method, ejaculation. The next section is about complications and cancellations. Now, do the patient cancel due to some reasons? The options is there. You can say the cancel date. Reason for cancellation. You select it and the cycle ends there. Is it my screen that is shaking or from everybody? Any complications from this? You see, as I select cancel, the status and all this change. So you always remember to look at the options you've picked before. If there's no complication, you say none. If there's complication, select what it is. You see a message. Yes, for gestational carrier, all you need is, you have their own record in your own clinic. And this treatment now, you will be doing this under the intended parent's name. I hope that answers that question. All right. Once you say there's no complication, you go to the next tab. Now, this is where the retrieval date comes in. Okay, I have somebody else with another question. Once you click on the date, you select the date for the retrieval, number of oocytes retrieved in the original cycle. If you are reporting different freeze dates to indicate the freezing of the oocyte or embryo from the same retrieval date on different days, different length of culture, you should change the number retrieved for the respective retrieval to indicate just those that were frozen on each respective day, such as that the total number retrieved. For all retrieval enter on the same date, add up to the actual total. And we don't use NBank here. If this would have been abroad, you see the option NBank came from so many different places in the US, but I don't think we are using NBank yet. So you fill in the date and other stuff. Indicate if intracycloplasm plasma injection ISIC was performed on the oocyte in this treatment. Total number for all fresh retrieval, the maximum number of pronuclear embryos that were observed during fertilization. Intravaginal culture, second day ISIC, PGT testing, was it done? Some, all of the embryos, or no embryos? Pick what is right according to your treatment. Assisted hatching, some or none, or all the transfers. Select. And once you're satisfied with the answers, you click next. Transfer attempted, the date of the transfer. Enter the most recent endometrial thickness in millimeters on the day of the embryo transfer, or HCG trigger. During the transfer, how do ultrasound guided, what method? Abdomen or Virginia. Now, number of embryos available on day of transfer, the number of embryos or fresh embryos transferred to the uterus. Even if the number was 0, you still need to indicate, indicates the number of fresh embryos that were cryopreserved during this cycle. Blasis transfer, total number of oocytes that were cryopreserved during the cycle. Put the numbers there according to your treatment. Now the treatment outcome. If you get here now, and let's assume the treatment is not pregnant, once you select that, the cycle ends there. But if the patient was pregnant, then your inputs continue. You have ultrasound dates. Record the number of fetal hearts noted on ultrasound before 7 weeks after the date of transfer. Or if no ultrasound was performed before 7 weeks, record the highest number of fetal hearts noted on the earliest ultrasound after the date of transfer. If the number of fetus was reduced, record the highest number of fetus hearts observed on ultrasound before the number of fetus were reduced. So you indicate that. And if this is a monoclonic or twins or multiples, indicate yes or no. Therapeutic reduction, indicate if a therapeutic reduction was performed on the patients to reduce the number of fetus, indicate either yes or no. and then you click next. So this will come to the delivery section of the treatment. So the outcome of the pregnancy, if you say it's live birth, therapeutic abortion, spontaneous abortion, maternal death prior to infant birth. So whatever it is, based on the treatment you did, you input that. So I'm going to say just live birth. And outcome source, this is where we have the most problem. Because once a patient becomes pregnant, sometimes they might not be communicating with the clinic always, but please do your best always to be able to get this information because you need it to complete your cycle. So if you have to be calling on the patient, checking on them every now and then, texting them, so don't wait until they come maybe for immunization and other stuff before you start, you finalize the record. Try as much as possible to have in contact. What date? And sometimes the patient might call you to tell you, oh, we had a baby, So that will be verbal from the patient, or it's just a chat message they send to you. So all these very, very important. And the method of delivery, if you are not communicating with them, you don't even know. But if they tell you, they might tell you, oh, yeah, I had a baby, but chances are it might be cesarean, or it might not be. But if it's unknown, since you only heard from them through a verbal, then the system with normal born, one, two, or triplet, you need to indicate also. And once you click on this complete cycle option, now anything we've missed is going to flag as incomplete. Watch this. You see the first one? Because a transfer has occurred, you must enter a transfer date. That is under transfer and outcome. Because I didn't put date on purpose, just for you to see. So these are stuff you need to be careful with, you see. We need to be able to put a date there. And if I put a date, now let's assume we start January 1st. So the transfer date might occur around maybe February 22 or so. Let me say 2025, February, let me say 12. So if I go back and try to complete, I'm going to get the error for this also. The number of embryos available. Let me just put it down. I purposely skip all those for you to see where the errors will come from. Number to the heteros, maybe 3. Creosalve, maybe 3. And what grade are they? All that too, you have to input that also. See, I'm just picking these for you to see the different options that you have. And now, if I go back again and I click complete cycle, I'm going to get the error for this also, the ultrasound date. So all this shows you that you cannot just skip an important part of the registry. So try as much as possible to input information as you know it to the best of your ability, ask the right question, and update properly. I've seen situations where some clinic will hire an IT person and give the guy a file or the lady a file to start doing the registry. Majority of the time, they might not be 100% accurate because any information they didn't see on the form you gave them, what they will do is just put unknown. So, and those are inconclusive because you can't be treating somebody and there's a section where he asks for the age, weight of the person and you say unknown. So what happens then when you give an injection? If you don't know the weight of the person and you don't know the age of the person, so it's not really good. So let's try as much as possible to input information as we have it. You can start while you are doing the treatment to be inputting your information in the registry. You don't need to wait until you complete. So every time the patients come in, whatever they do, they document it in your own file and input it into the registry. So it makes sense a lot when you are doing that because then the chances of error will be reduced. It will not be as somebody just taking the folders, trying to input all that. They don't even understand. Some injection stuff they might not even know. Any question again so far regarding what I've said? So this means that we all clear and we all understand. And one option I give everybody also, especially for the new people just starting on this, you can have a private chat with me. I can give you a username and password to practice on the test database also. So instead of just inputting or practicing through the information in your own clinic, I can give you access to this testing database for you to input some records, just look at it and understand the process. And if you have any issue also, you can reach me. I know most people have my number, but I'm just going to share it again here for everybody. And this is my WhatsApp number also. I can be reached 24 hours if possible. And when you create users in your clinic, please give them admin rights so that if you forget your own password, they can use their own information also to log in and help you reset your own password. But if you don't, then that means you have to send a message to me with your name, and then I have to be the one to help you also. And don't continue to be using just one account in your clinic. Let two or three people log in separately on different system. Let them be inputting the records. Like now, we've collected for 2024. So I know towards the end of this year now, we're going to be collecting record for 2025. And I know almost all the clinics will be available this year in Abuja. So we hope we're going to have a physical training there. All right, you need the tutorial video for this. Well, technically, yes, I can see whether the secretariat can share this Zoom recording with you, but the fastest and easiest way is for me to give you an account for you to come and log in and try to input the record. Yeah, Professor Wolabi, I just answered the same question, sir. No problem. The secretariat will see if they can share this. But you see, I'm not using any record to do this. The good thing will be to pick a record from your own clinic. I can give you a, a test user account that you can log in with and try to put the record. You can change the name into the test database, but just put in so you will see what it is and see what errors you will get as you do. But if there's anything else we can do, yes, just reach out to us. But they will try and see if they can get you, the recordings for this. Any other question? So I guess we all have a foot in it. So let's start inputting data and start getting ourselves familiarized with the registry. So yes, anybody that need a test user account, just chat with me so that I will know from which clinic and other stuff. Then I can send you a username and password that you can use. So you don't need to use your own clinic information and you don't need to go and mess up recording your own clinic. You can do it in the test database. So reach out to me on WhatsApp. I'll give you an account to use. Any question before we bring it to a close? So every other one, we can start doing support for you guys. You can start calling, chatting. If there's no more, then I think we can call it a day. So anybody that needs those test user account, just let me know. Send me a message and I'll create those and I'll share with you. Yes. Uh, Mary, what's your question? Just type it in. I'm reading all as we're going. Hello, Mary. What is your question? You can unmute yourself if you want to talk, Mary. Or send your message to the chat. Okay, can we document for egg donors and egg recipients? Well, the question is, can the data entry must be entered after all the treatment? No, you can start entering the data as you are treating the patient. You don't need to wait until all of it is gone. Let's assume the person coming on the first day. You can create a user account for the patient and all the stuff. And then as they come in, whatever they do, after the patient leave, they can input the record also. So that is more or less like inputting your record reciprocally. And the next question, can we document for egg donors and surrogates? That one, you can, under your own clinic, yes, you can do that. It's not part of the record that we collect for AFRH, but you can do it. Although you will have a file for your surrogacy in your office. So all you just need to do here, if the person is using a gestionary carrier, all we do is we just need the date of birth. That's it. And for egg donors, oh yeah, you need the information, the age of the donors. I think that's coming from Prime Clinic, Prime Care Facilities. Any other question? Well, Tolu, are you on?
Yes, I'm on. I'm here.
All right.
Good afternoon.
Afternoon. If there is no more question, then you can bring the Zoom to a close, and any other person that needs to reach me, they can chat with me, especially those that need to practice on the database. Okay?
All right.
So we thank everybody that comes in. I think we have like about 35. Okay, some have left. You're all welcome for taking time to attend this training. We're going to be having it like once a month or every 2 weeks or something like that. I don't know. But where is Yegide? You all have a nice and wonderful day.
Thank you.
You're welcome. Okay, somebody is asking, Gabriel is asking one question. He said, I was hoping the training would stretch to childbirth. My question on fetal heartbeat. Yes. What's the question on fetal heartbeat? So it's more or less towards the before delivery. That's what that is. If you go, let me go there for you to see. Now, it says here, the maximum fetal hearts. Record the highest number of fetal hearts noted on ultrasound before 7 weeks after the date of transfer. Easy. If you do ultrasound, what do you feel? You feel like, oh, there's one or there's two. That's just what that's what it means. Does that answer your question?
Hello, good evening, sir. Sorry,
Yes.
I'm trying to type. Can I ask a question like this?
Sure.
Okay, we usually have a problem when we're entering our fatal health dates because usually it's supposed to be 10 to 120, 160 per minute. But then whenever we try to enter the normal figure, it doesn't work. So we end up
For
choosing the
for
number of
which
the
one?
child that
For
the
which
woman is
one?
carrying. We normally enter the one. The fatal heartbeat,
Yes.
sir. The fatal
Yes.
heartbeat. So when we enter the what we get from between 110 to 160, the system normally reject the figure.
All
So
right.
we
Now,
end
let
up
me tell
entering the
you,
number of the baby the
yes,
woman
the
have
number
now.
of the baby is what the system is asking you. Look at it this way. Maximum fetal hearts, not the heartbeats. Maximum fetal heart. It means record the number, the highest number of heartfelt fetal hearts noted. You know, like when you do
Okay.
ultrasound, yes, that's why, he's not going to take that heartbeat. He's looking for how
Heartbeat.
many
Okay,
did
sir.
you feed? Yeah. If you felt 2 heartbeats, then you
Okay, sir.
input 2. Yeah, that's what it is.
Okay, sir. Okay,
All
I
right.
understand it now. Thank you, sir.
You're
Not,
welcome,
and
Gabriel.
the question is not feel, Tim. It is not feel. You are doing an ultrasound scan, so you are seeing, not
Okay,
feeling. Do you
yes.
understand? So
Okay.
number of fetal hearts seen. If you see 3, it means you are dealing with a triplet pregnancy. If you see 4, you are dealing with quadruplet. So not fetal heart rates, but number of fetal heartbeats.
Okay. Yeah, that's what I'm saying. Okay, they see it actually. I think that answers his question. He was thinking it was the heartbeats. Thank you, sir.
Welcome.
Yes, sir. Any other questions?
Hello, sir. You've not answered us about the if we are going to record the egg donors and our surrogates.
Yes.
The answer is yes. Tim, let me answer that question.
All
Now,
right, sir.
if you look at the initial registration part, it determines what the patient is coming there for. So my advice is every patient you see, register them from the onset of encountering them, not when you start the IVF treatment. If you know you're going to do IVF eventually, record all their data, and as you go along, you can. Now, the drop down boxes indicate what kind of patient that you are seeing. If it is donor, it indicates that clearly, and you register your donors as individual patients. So if you are going to now pick a donor for a recipient, the recipient has been registered separately. They are not registered together. But you then go to the drop-down box to link the donor to the recipient that you are intending to use her for. Some donors are registered for oocyte banking strictly, and that option is also seen there. So I get, we're going to have to take time to
Yes,
go
sir.
through each of the modules one by one and explain
Okay.
them in detail so that
Okay.
we're not going from the beginning to the end. I think the next session we will start from, I don't know where I see you got to the end up to
Yeah, delivery
finalizing
another
data.
time.
Yeah. But we
Okay.
will now have to go back and then start taking each
Section.
tab, yes, each tab, and explain each section for the whole of that training session.
Okay, so people will be able to understand exactly what that is all about from the history to
Yeah.
the delivery.
Yeah.
All right.
Yes.
I think they have another Zoom with the AFFS. So,
Yes, we do.
all
Yeah.
right. So we can end this one, sir.
Okay. Thank you, everybody.
Okay.